Madam Chair, council members, and participants, we are now live.
Thank you. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, city council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Intelligencer, Legal Intelligencer, and Inquirer prior to the hearings, and can also be found on phlcouncil.com. I now note that the hour has come. Madam Clerk, will you please call the roll to take attendance? Members that are in attendance will please indicate that you are present when your name is called. And also, please say a few brief words when responding so that your image may be displayed when you speak on screen. May be displayed on screen when you speak. Madam Clerk?
Councilmember Heenan.
Good morning, Madam Chairman. Good morning, colleagues.
Good morning.
Councilmember O. Councilmember Gim.
Good morning, Madam Chair. Good morning, colleagues. I am present.
Good morning.
Councilmember Green.
Good morning, Madam Chair. Good morning, colleagues. I am present. Looking forward to today's conversation.
Morning.
Councilmember Thomas.
Good morning, Madam Chair. Excuse me. Good morning, colleagues. I'm present.
Morning.
Councilmember Brooks.
Good morning, Madam Chair. Good morning, colleagues. I'm present.
Good morning.
Chair Bass.
And I am present. Thank you. A quorum of the committee is present, and this hearing is now called to order. And this is the public hearing of the Committee on Public Health and Human Services regarding bills number 210510 and bill number 210511. Madam Clerk, will you please read the title of the bill and the resolution?
Bill number 210510, amending Chapter 6-200 of the Philadelphia Code, entitled Preventative Medicine, by adding a new section offering gift certificates to citizens and property owners of Philadelphia who receive vaccinations for COVID-19 in order to incentivize immunizations against the disease, all under certain terms and conditions. Bill number 210511, amending Chapter 6-200 of the Philadelphia Code, entitled Preventative Medicine, by adding a new section offering vouchers for rebates on city gas and water charges to citizens and property owners of Philadelphia who receive vaccination for COVID-19 in order to incentivize immunizations against the disease, all under certain terms and conditions.
Thank you. Before we begin to hear testimony from the witnesses we have for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments they have for witnesses, I will note that for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. And before I call on the clerk to call the first panel, would any of my colleagues like to make an opening statement or comment? Okay, seeing none, Madam Clerk, please call the first panel of witnesses.
Our first witness is Cheryl Bettigoli, Acting Health Commissioner.
Thank you. Is the Commissioner available?
Yes, good morning.
Good morning. How are you?
Good, how are you?
Very well. Please state your name for the record and proceed with your testimony.
So good morning, Chair Member Bass and the members of the Public Health and Human Services Committee. I am Dr. Cheryl Bettigol, the Acting Health Commissioner for the City of Philadelphia. Thank you for allowing me to give testimony on Bill number 201510 and Bill number 210511, which, if enacted, would provide authorization for the city to create certain incentives for COVID-19 vaccinations for Philadelphia residents. Although the use of incentives is an evidence-based strategy for increasing vaccination rates and is supported by the Centers for Disease Control and Prevention, and although the Philadelphia Department of Public Health strongly supports the use of incentives to help increase vaccination rates among Philadelphians, the administration recommends that City Council hold temporarily Bill number 201511 to allow time for current incentives to roll out and to assess their impact. Philadelphia has been making progress toward containing the COVID-19 pandemic and toward greater equity in our containment efforts. To date, 67.4% of Philadelphia residents age 18 and over have had at least one COVID-19 vaccine, and 52% of residents 18 and over are fully vaccinated, resulting in dramatic drops in case rates and hospitalizations. Our vaccination rates compare favorably with the national rate of 64% of adults who have received at least one shot, and with the rates in other large cities. For example, New York City at 64% of adults, and Chicago at 64.1% of adults. Though focused efforts together with many partners, through focused efforts rather, racial disparities for Philadelphians 45 and over have closed. But we still have a great deal of work to do to reach younger Black city residents. Our data team has worked to identify the census tracts with the lowest vaccination rates, and we have worked with partners across the city and through our own teams to place brick and mortar, mobile, and pop-up vaccine clinics in those locations. Community vaccine providers, including, of course, the Black Doctors COVID Consortium, have been invaluable partners in this work. And the assistance of FEMA and the Pennsylvania National Guard in vaccinating large numbers of city residents at the Convention Center and at Esperanza greatly expanded our ability to reach city residents. But despite all of that work, we know that there are people in Philadelphia who are on the fence about getting vaccinated and haven't yet gotten their shots. According to community surveys by Philly Counts, only about 13% of Philadelphians say they will not get a vaccine. The remaining people who have not yet been vaccinated are still waiting, some for more data, some because of concerns about side effects and missing work, and some just for the right opportunity. This is the time for us to reach those who are still waiting. The work we do this summer will determine whether we still have pockets of unvaccinated people in Northwest and Northeast Philadelphia, pockets where a new surge of infections could start in the fall. It will determine whether Philadelphia still has people who remain vulnerable because we have not yet found the right way to reach them. Incentives will not motivate all of them, but they could make the difference for those who are still saying yes, but not yet. Incentives provided by community partners, including our local sports teams, have helped to bring people to our sites. We're working with the University of Pennsylvania on the vaccine incentive sweepstakes designed by a behavioral scientist that the administration announced yesterday. We're very excited about that announcement and about its potential to further increase vaccination rates in the city. The sweepstakes was designed by the Center for Health Incentives and Behavioral Economics at the University of Pennsylvania, which is hiring a third-party sweepstakes vendor to implement the sweepstakes. It will involve weekly drawings beginning on June 21st, with 2 $50,000 prizes, 6 $5,000 prizes, I'm sorry, that's actually 4 $5,000 prizes, and 6 $1,000 prizes each week for 3 weeks. 1 week before each weekly drawing, a new selected zip code will be chosen at random from Philadelphia zip codes with the lowest vaccination rates as of May 2021. Half of the subsequent week's lottery winners will come from that selected zip code, and the rest will be drawn from the city's remaining 47 zip codes. The selected zip code will be announced a week before each drawing, and the residents will be informed that they have especially high odds compared to other Philadelphia residents of winning a prize in the following week's sweepstakes if they receive their COVID-19 vaccine by the day before the drawing. Any winnings that have not been allocated by July 8th will be given out in a bonus sweepstakes on July 9th following the usual rules. So half to selected zip code residents, half to residents of all other zip codes. And for the first time ever, the CDC recently announced that it will allow use of grant funds for incentives for vaccination. This is usually completely forbidden. The Public Health Department is currently working on a revision request that would allow us to take advantage of this new policy with the plan to use $2.5 million in grant funds for vaccine incentives, including for gift certificates. We look forward to working with City Council as we roll out an incentive plan that will continue the positive trends we're seeing. While we're strongly supportive of incentives and are excited to see City Council's enthusiasm to encourage vaccinations, the administration has concerns about Bill 210511 in terms of equitable delivery and implementation time. We believe that our current incentive plans are strong and will meet Council's intent to use incentives to maximize vaccination rates. Thank you for the opportunity to offer testimony on these bills and for your partnership in ending this pandemic for all Philadelphians. I'm happy to answer any questions.
Thank you, Commissioner. Thank you for your testimony. Are there any questions from members of the committee? Okay, seeing that there are no questions. Oh, Councilman Bobby Heenan.
Thank you, Madam Chair, and good morning, Acting Commissioner, and thank you for stepping up to the task that you have. Godspeed. I say that with humor. Keep doing the good work. I just had some questions, and they're dating back several months and even to the end of 2020. So the surveys that we're talking about now, and the surveys we've been hearing, basically mirror the surveys that were early on in when the vaccination plan was first submitted to the CDC and the onset of the process of putting together the comms plan for Philadelphia and how it vaccinates its citizens. How come things haven't changed in your opinion? So we're incentivizing now, and don't get me wrong, I think we should, for the simple fact that the rates are what the rates are, right? There's certain parts of our city and communities that haven't been vaccinated. Was it lack of execution of our comms plan that was supposed to start in January? I just don't know why we are where we are at this point, when there was a robust plan that was submitted to the CDC back in November. We had our first hearing with this committee back in November. There's been a lot of controversy back and forth on who's getting vaccinated, how they're getting vaccinated, how they're being communicated with. I'm just a little curious on why we're in a similar position, other than 52% of adults are currently fully vaccinated. So my question is, what's going to change in addition to the incentives on communicating in the hard-to-reach neighborhoods and neighborhoods who have traditionally have distrust with government and vaccines?
So it's a big and important question. I would not necessarily agree that nothing's changed. So I was not part of the vaccine effort for the first few months, but was brought on at the beginning of February with a group of other folks to see, just to get a bigger, deeper team. And one of the things we did at that point was really to take a data-driven equity approach and to say we need to figure out, initially we use zip codes and then we move to the census tract, which is just that smaller level analysis. Where are we missing people? And locate vaccine opportunities and information in those places. And if you look at the week-by-week analysis of who is getting vaccinated in Philadelphia, it is majority Black and Latino residents who are getting vaccinated week by week now. So I think we've made big differences there. We are seeing the needle move slowly in terms of acceptance of vaccine. When Philly Counts does those surveys, people are gradually shifting. I think one of the things that shifts people most effectively is when they know other people who've gotten vaccinated. So one of the reasons that I'm so interested in incentives, it's not that I believe that everyone's going to, be motivated by an incentive, but if we reach one person in a family or one person on a block with an incentive, and then that person talks to the people they know, that's going to help us to move the needle the rest of the way. So we are, I think, in a very different position. in terms of our disparities by race and by ethnicity, they have closed with the exception of the younger Black residents. And some of that may be that we were too effective in saying, please wait your turn, you're not at risk to that younger group, because now we're really trying to reach them. But for people over 45 and over, the disparities really have closed remarkably. So we've made some progress there, and then we just need to reach everybody. But there is a big canvassing effort now through Philly Counts, just getting out into neighborhoods, getting information to people, and then getting the vaccine into neighborhoods as well.
Yeah, well, that's good to know about Philly Counts, and by no means do I mean I know that you were not a part of, and I appreciate, and I know your history with childhood obesity and your longevity with the department and doing a lot of good things. So I do appreciate that, and I look forward to continue to work with you. I was talking about we have identified from the onset where our challenges were going to be, and I just don't think we met our communication and outreach goals that we needed to do from the beginning. All right, we got derailed. Things were a little confusing. I think we were just trying to figure out the execution of the plan and delivery of the plan as we go. So I guess it's more of an ask. Can we increase our communication plan to these neighborhoods and to these communities that where there is a gap, because it is incredibly important. And the numbers really haven't changed from early on who is going to get vaccinated or who will absolutely not get vaccinated, and those in the middle, those 15 to 20% who are just going to wait and see the effect on others, and just the time for trust. And that only comes with, as you said, vaccinating their neighbor, their uncle, their aunt, their brother, their sister, their mother, but that goes with a real robust communication and education plan. So I feel very, very strong with that. Our initial plan was an 18-month plan. All right, it was fast-tracked, because of the federal government and the availability of our vaccines increased, dramatically, as you had stated in your testimony. So, in the end here, I would just ask that the department increase its communication plan. I still haven't even heard where we are with any of the community-based organization RFPs, where they they held up on it last I heard. Have you brought more people on board to get in these neighborhoods where they're trusted community organizations and or folks that people can rely on to reach that 15 to 20% of our population?
Yeah, so I completely agree with what you're saying about the importance of grassroots community outreach, the direct communication to people in neighborhoods, as well as mass communications. All of that is critical. A lot of that work is going to happen through our partnership with Philly Counts and really staffing up and getting people out, getting trusted communicators out into neighborhoods. And I'm blocking on the second part of your question. I'm so sorry.
It was the community organizations and
oh yes, sorry. 11
communication plan to help getting to certain communities and to the general public and overall.
Yeah, so 11 community organizations were funded through the RFP and are out doing vaccinations, and I think that's really helped to extend the effort into neighborhoods. And one of the other things we've done is for groups that weren't successful for the RFP, because the process of becoming a vaccine provider through CDC is pretty complex, but we've been able to do some partnerships with some of those organizations to do pop-up clinics to reach the neighborhood, and they have the connections to bring people in. So we've been getting some great feedback on those efforts as well, as a way of just really connecting with people through the organizations they know and trust.
Great. Well, thank you. good luck with ensuring that the plan gets executed and with the high integrity and the right information. Anything that we could do as council members to help assist you, feel free to circulate any of the information that you have, and we'll certainly get them out to our platforms and in our communities. So thank you.
Great. Thank you very much.
Thank you, Councilman Heenan, for your questions. Very poignant, very important. And we thank you for your time and attention towards this matter. Commissioner, I'm going to take your testimony as being for both bills for, hold on one second, bill number 210510 and the companion bill 210511. So there's no separate testimony, am I right?
That's correct.
Okay, all right. Chair recognizes Councilman Isaiah Thomas.
Thank you. Thank you, Councilmember Bass. Thank you, Madam Chair.
Thank you.
I just want to take a minute to say thank you to Councilmember Heenan for his line of questioning. I think it's extremely important. He just communicated concerns that we've been trying to stress to the administration since the start of the pandemic. I also just wanted to make myself available to try to help with the demographic that you're saying you're struggling with. I talk to these young people on a consistent basis, and if there's any way we can provide education, right? Because incentives are great. I think that that's one good mechanism, but there is this, there's a lot of misinformation that's being presented out there, especially through social media, and we're not doing a good job of combating that. We're doing a good job of advertising and incentivizing, but we're not doing a good job of providing facts and information. So anything I can do to help, like my colleague said, I just want to be here for support. Thank you, Madam Chair.
Thank you, Councilman, and thank you for recognizing and putting it out there that there's so much misinformation, and particularly on social media, which I think we should abolish altogether. Just kidding. There's just a lot of misinformation, and it travels very quickly. So the more we can get in front of it and make sure that people have the facts, the better off we all are. Are there any additional comments from members of the committee? And I don't see any for this witness. Thank you very much, Commissioner. Are there any additional witnesses to testify or anyone who would like to speak on these bills whose name has not been called? There being no further questions from members of the committee and no other witnesses to testify, I'll ask again if there's anyone else who is present in the hearing whose name we have failed to call and that wishes to offer testimony on the bills being considered today. And hearing none, I want to thank the Commissioner for her participation. We value your opinion, and I now invite you to please disconnect from the meeting before we go into our public meeting. And we will now pause the proceedings briefly as the Commissioner exits. Okay, I see she has exited. This concludes the public hearing of the committee, and we'll now go into the public meeting to consider the action to be taken on the bill before this committee today. Madam Clerk, will you please call the roll to take attendance? Members that are in attendance, please indicate that you are present when your name is called, and also say a few brief words so that your picture and image will be displayed on screen as you speak.
Councilmember Heenan.
Good morning, Madam Chair. I am present.
Good morning again.
Councilmember O. Councilmember Gim.
Good morning, Madam Chair. I am present.
Good morning.
Councilmember Green.
Good morning, Madam Chair. I'm still present.
Good morning.
Councilmember Thomas.
Good morning, Madam Chair. I'm still present.
Good morning.
Councilmember Brooks.
Good morning. I'm present.
Hello. Good morning.
And Chair Bass.
Thank you. A quorum of committee members is present, and the chair recognizes Councilmember Heenan for a motion on bill number 210510.
Thank you, Madam Chair. I move that bill number 210510 be reported out of committee with a favorable recommendation, and further move that the rules of council be suspended as to permit the first reading of this bill at our next session of council. We need a second.
Second.
Thank you. The chair notes for the record that Councilmember Gim has seconded the motion. It's been moved and properly seconded that Bill number 210510 be reported from this committee with a favorable recommendation, and further moved that the rules of council be suspended to permit first reading of this bill at the next session of council. All of those in favor of the motion will signify by saying aye. Aye.
Aye.
Aye.
Any opposed? The ayes have it, and the motion carries. The chair now recognizes Councilmember Heenan for a motion on Bill number 210511.
Thank you, Madam Chair. I move that Bill number 210511 be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended as to permit the first reading of this bill at our next session of council.
Can we get a second?
Second.
Thank you. The chair notes for the record that Councilmember Green seconded the motion. It's been moved and properly seconded that Bill number 210511 be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All of those in favor of this motion will signify by saying aye.
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 Is anyone opposed? Okay, the ayes have it, and the motion carries. And for the record, Bill number 210511, which we have just passed out of committee, will be moving out of committee and to be held on the calendar until to address some concerns on the bill. But we'll move out of committee and then be held on the calendar. This concludes the business before the Committee on Public Health and Human Services today. I want to thank everyone for their attendance bright and early this morning. Thank you and have a wonderful day.
Thank you.
Thank you.
Thank you. Have a great day.
Thanks, you too. Thanks, everyone.
Thank you, Madam Chair. Thank you, colleagues.
Thank you.